you will, a 36-year-old man who is practically the picture of perfect health. He very rarely ever gets sick, and when he does, he's very rarely ever sick for more than 24 hours. He has never smoked or done any kind of illegal drug in his entire life. As a matter of fact, when he was just 15, he took an oath that was almost religious in his zeal to never pollute his body with drugs or tobacco of any kind. And for over half of his life, he has held true to that oath to the very letter. As a matter of fact, until very recently, he rarely ever even took a headache remedy for that very reason. Now imagine that this same man finds out that he has thyroid cancer as the result of what was supposed to be a routine checkup. Not only does he have thyroid cancer, but the mass, his thyroid, is the size almost of a softball. A healthy thyroid is normally the size of about a quarter. Not only that, but because of his very thick neck, that mass went undetected, even by his doctors, for 5 to 10 years. Hard to believe, isn't it? Yeah, that's what me and my husband thought when we found out that he had thyroid cancer early last year. I'm no expert in medicine or on the subject of cancer. What I am, however, is a loving wife that has stood side by side with her husband, fighting the most serious battle, the scariest battle of our entire lives. Today I'm going to tell you about the 4 different types of thyroid cancer, the possible symptoms that you might find, and the treatment. But first, it's important for you to know what the thyroid is and where it's located. As you can see, this is a picture of a healthy thyroid. The thyroid, as I said before, is about the size of a quarter. It's butterfly shaped, and it rests just below the voice box. What it does is it secretes hormones. It's part of the endocrine system, and it secretes hormones into the bloodstream. Without it, you would die. According to the National Cancer Institute, my husband was just one of over 37,000 people that were diagnosed with thyroid cancer last year. 1,600 people died last year also as a result of this disease. We were very lucky. The American Cancer Society's website states that there are 4 different types of thyroid cancer. The first type is by far the most common. It is the type that Jim had, and it's called papillary carcinoma. It affects 8 out of 10 people that are diagnosed with thyroid cancer. It's slow growing and very easy to treat. As our oncologist, Dr. Bumpus of the James Brown Cancer Center in Louisville, Kentucky said, if you have to have cancer, this is the kind that you want to have. It can, however, spread to other parts of the body, including your lymph glands and your parathyroid glands. The second type is follicular cancer. It is the second most common type. Unlike papillary cancer, it doesn't normally spread to the lymph nodes. It can spread to other parts of the body, however, like the lungs or the bones. Because of this, it has a higher mortality rate than papillary carcinoma. The third type is medullary thyroid carcinoma. This particular type of cancer does not respond to radioactive iodine, which is a problem because the thyroid is the only organ in the body that absorbs iodine. So a common treatment is to radiate that iodine and make the patient ingest it in the hopes that that iodine will be absorbed by any remaining live cancer cells and die. Because it doesn't respond to this treatment, it does have a much higher mortality rate than the other 2 types of cancer. It's also not uncommon for this particular type of thyroid cancer to have spread to other parts of the body before it's even discovered in the thyroid. The 4th type is the scariest type. It is also, thank goodness, the most rare. It's called anaplastic carcinoma. It is also known as undifferentiated carcinoma because these cells, once they get cancerous, very rarely and very little do they resemble a normal thyroid cell. If you could ever imagine a cancer that you would want to have, this one would not be the one. It's extremely fast growing and aggressive. It often metastasizes into other parts of the body, and it's very hard to treat. It has the highest mortality rate of all of the thyroid cancers. You may be thinking, okay, well, that's all well and good, but what do I do if I suspect that I might have it? Or how would I even know? Well, there are several possible signs. The Abramson Cancer Center at the University of Pennsylvania states that you will notice, or you may notice, a lump in your throat. Normally, the thyroid cannot be felt with the fingertips. If you can feel it, you need to go have it checked out. If you do find one, don't worry, however, because most of those lumps, a lot of people have them, and most of them aren't cancerous at all. You may notice several lumps, or you may notice a large mass, which is what my husband had. The mass can be in one of two places. It can either be right on the thyroid, which means that the disease is probably located just in the thyroid, or it might be in an area of the neck that is somewhat removed from the thyroid, and that usually means that it is spread to other parts. According to Dr. Ryan P. Smith of the Abramson Cancer Center at the University of Pennsylvania, and I quote, "Thyroid tumors can also at times present as hoarseness or with symptoms of tracheal or esophageal compression, such as shortness of breath, air hunger, problems, or pain with swallowing or neck pain. If someone you love is diagnosed with thyroid cancer, though, have no fear. The Mayo Clinic's website states that the treatments for thyroid cancer are as follows. The most common is surgery, and that would include a complete thyroidectomy or a removal of the entire thyroid. They normally will remove the whole thing rather than just the cancerous part in order to prevent the cancer from recurring again. If this happens and you have to have that surgery, it will be necessary for you to take a thyroid replacement hormone pill for the rest of your life. They will also, while they're in there, look to see if your lymph nodes are enlarged. If they are, they will remove them and have those tested for cancer, as well as the parathyroid glands. You have 4 of those located near your thyroid, and they are responsible for regulating the calcium in your body. The second type of treatment is radioactive iodine. We had this procedure done. I'm going to tell you really quickly how it's produced, how it happens. You go to the doctor's office, and they bring in a dolly or a hand truck like you use for moving. And on that hand truck is a lead-lined ammo case. Inside the ammo case is a lead tube. Inside that lead tube is another lead tube. And inside that lead tube is a pill. And they tell you to take it and get out. So my husband did, and he went to a hotel for 3 days because he couldn't come home. Now, before you get all excited and think that the hotel staff was in jeopardy, radiation of this type does have a half-life. By the time he checked out, there was no more radiation left in the room. But for the duration, whenever anybody went to take him something that he needed, we had to knock on the door, set the item on the floor, and then back away 6 feet before he could come to the door. After the radioactive iodine, they will do a body scan to see if there are any remaining thyroid cells left. If there are, then they do beam radiation. Beam radiation is where the radiation is targeted directly at the spot where your thyroid used to be, and it will go on 5 days a week for several weeks. They say 4 to 6 weeks. Jim did more like 8 weeks. The side effects are your food is not going to taste good at all. It may taste like motor oil or dirt or spoiled, but whatever it is, you're eating to live and not living to eat because it doesn't taste right. Your saliva glands may get dried out. You'll have neck burns all the way around, and you may lose your hair. But it will save your life, as we found out. In short, there are 4 different types of cancers I explained. The signs can go undetected for quite some time, so it's important to have regular checkups with your physician. But have no fear, because it is a very treatable cancer. This hasn't been an easy year. It's been the scariest, most difficult thing that he and I have ever faced, either together or apart, for our entire lives. After 2 surgeries, one of them, the first one, was botched, a handful of pills that he has to take every morning just to stay alive, and all of the radiation. We did get a call about 4 to 6 weeks ago from Jim's oncologist, and he said that Jim is cancer-free. For the next several years, he will have to continue to have those full body scans to make sure that none of the cancer has returned. But right now, he has a clean bill of health, and that's all that we can ask for. we're just very happy to say that it can be beaten, and my husband is proof positive.